Health authorities are discussing the fate of indoor mask requirements here in the country amid much public fatigue over the prolonged presence of this particular pandemic-related mandate. So what is the response among medical professionals? What is the importance of COVID-19 tallies in deciding the fate of face masks? And what are the prospects of new variants as we seek to ease restrictions? Welcome to Issues and Insiders. Today we delve into a recurring debate over one particular pandemic mandate that remains in place here on the local front. That is, to mask or not to mask indoors. For more on this, I have Dr. Alice Tan at MizMedi Women's Hospital live on the line. Dr. Tan, it's a pleasure to have you with us.
Thank you for having me.
I also have Professor Sohn Ho-joon at Seoul National University live on the line as well. Professor Sohn, it's good to have you with us.
It's great to be back.
Dr. Dan, first then, what are your personal thoughts regarding plans to possibly lift indoor mask requirements here on the local front?
Well, whether indoor masking is mandated or not mandated, I think it's still very good public health prevention policy. Try to prevent acute infection from respiratory viruses. We know right now that acute respiratory virus season is upon us. The influenza-like illness detection rate went up to 17.3%. That's an increase from 15% the previous week. We are approaching pre-pandemic levels right now of acute viral illnesses. So it doesn't really make sense to lift a mandate or a recommendation, at least, for indoor masking at this point in time. I would like to see us get over acute virus season before we contemplate this next move. We should also remember that our last big COVID wave that happened in the winter, this last winter, really started the third week of January. So we're not quite there yet in terms of even with what might happen with COVID in terms of another surge upon what we are at right now. So I don't think right now is a time to lift the indoor mask mandate. Having a mandate in place also, it takes the pressure off of businesses that may have to try to, on their own, impose their customers for wearing a mask in order to protect their employees and the indoor environment. So in my opinion, it's a way of aligning what's good for public health and our public health policies to keep the indoor mask mandate in place right now.
Right. Authorities, Professor Sohn, for their part, say the fate of the indoor mask mandate will be made after taking into account the daily tallies for infections, fatalities and critical cases. What are your thoughts, Professor Sohn, regarding the importance of these particular tallies in determining the fate of the country's mask mandate?
Yeah, so all of these tallies are important indicators, especially number of new cases, number of people who are being admitted to the hospital and in critical care, number of people dying resulting from both indirect and direct causes of COVID-19. I think what we need to think about recently is that the number of cases is not as much valuable for us in informing, how significant the disease is. The disease spread is out in the society because we know that these are very much underreported estimates because testing has not been as rigorous and people are doing self-reported testing. So it's hard to figure out the numbers that we see as new cases a good indicator for the significance. What we can attribute to the number of people dying from COVID or a number of people in critical care is an important indicator to gauge how significant the problem is in the society. And right now, what's been good for us to see is that there is a bit of trend that the mortality rates and admission rates have been declining over subsequent variants that are being rising in our society. So that the authorities are looking at these these two particular indicators to really decide whether or not we should free up the mask mandates. But as Dr. Tan has mentioned, the mask is an important intervention for us to prevent spread of the disease, not just the COVID-19, but all other respiratory illness that's going on right now. So I'm not going to comment that it's too early or too late to lift the mandate, but I think we should really continue what we are doing for this flu and multi-respiratory illness season, and then see we see back in spring we could potentially relax this measure a little bit, especially for the indoors.
Right. Dr. Dan, with regard to the current wave, contrary to early expectations, Korea's seventh wave has not led to an alarmingly high daily infection number. I believe initially there was talk about the daily tally hitting 200,000 at the height of this latest wave. That being said, do you suppose the worst of this current wave is over, or is it too early to say?
I think it's too early, and I think it's when we look at, as I said, what happened last winter, the big COVID wave due to Omicron really started the third week of January, and we're not quite there yet. Of course, here in Asia, in South Korea, we celebrate Lunar New Year, which occurs later in the winter season, and that's a time of gathering and traveling, and so that could also add to a surge in cases. If we look at the number of people currently in ICUs, we're close to 500, and the last time that we were at this level of critically ill cases, the daily case tallies were above 90,000. We do not do wastewater surveillance in Korea. That would give us a little bit more information in terms of where we are. But if we look at test positivity, it's exceedingly high. It's consistently over 50%. So this just lets us know that the daily case tallies are not truly reflecting what's going on. I think we are probably going to see more and more cases as we go into the winter, especially if we lift indoor masking.
Right. And Professor Sohn, how long can we expect to endure this vicious cycle of rebounds and retreats?
Yeah, so this has been an ongoing debate for, already 3 years now. I think we can only kind of gauge as when we really see the COVID mortality, COVID-related mortality rates are similar to what we have seen on seasonal influenza. We are sort of approaching that, but then we also see that this has been affecting a very particular group of much older people. Much more vulnerable people are actually facing much more adversity from COVID-19 illness. So it's not just a function of whether or not we see a peak or not. It's more of how disease severity has been evolving over various variants. What we also have to be very cautious about COVID-19 is that there have been so many variants now. I think about 300 variants are actually circulating at this moment. And their dominant variants are changing almost monthly, on a monthly basis. So, and we are sort of at a stage that we can predict what kind of next variant would be, but we're still not certain yet. So once we have some certainty about the patterns of the variant, and that we have a stability in disease fatality and severity, I think at that point we can sort of push the COVID-19 issue similar to the issue that we've been dealing with the seasonal influenza.
Right. And against the backdrop of new variants, Dr. Tan, starting this week here in Korea, bivalent boosters are available to those aged 12 and above. Now, previously, they were only available to those aged 18 and above. What can you tell us about the importance of bivalent boosters at this particular point of the pandemic?
Well, we know that vaccine effectiveness wanes with time. There was a report published in the BMJ that showed that vaccine effectiveness against emergency room and urgent care visits decreased to about 46% at about 4 to 5 months after a non-bivalent booster. And so we may be at that level for many people in our country. And so we want to do what we can to boost protection. And what was found from the US CDC is that a bivalent booster does add a level of protection against symptomatic illness. We don't have data for severe disease and death yet, but in terms of vaccine effectiveness against symptomatic illness, depending on the interval between the last dose of a COVID-19 vaccine, a monovalent dose, and a bivalent booster, the added protection, vaccine effectiveness was about 30 to 50%. So not super, super high level, but there was definitely added protection. And so that's what we're seeking to do, is we're trying to increase the level of protection for individuals, but also in the population against infection, and also, of course, most importantly, against severe disease and death due to COVID.
Right, of course. And Professor Sohn, back on the subject of easing pandemic-related restrictions, how do you respond to the possible lifting of mandatory isolation for COVID-19 patients, which of course is not the case here in South Korea at the moment, though?
Right. So in order for quarantining to be very effective is that we need to have a very effective quarantining monitoring system. I think for those who have been test positive and have been reported to the government have been monitored. But again, compared to earlier phases of the pandemic, the monitoring of the quarantining process has not been as rigorous. I think that's the natural course of how it is in Korea and elsewhere in the world. So to me, having a mediocre quarantining monitoring system, but then giving the burden of the mandatory quarantining will not be so effective, and we will probably phase this out as, again, seeing that the mortality and the severity cases decline over time. So I think it's right now we still have to have this in place, but the monitoring efficiency has not been as effective, especially given that many cases are actually not being reported, therefore meaning that many of them, more than what's been reported, tenfold have been going out and circulating and spreading the disease, that the effectiveness of the quarantining is not so good at this time.
Right, I see. Meanwhile, Dr. Dan, moving forward, there are concerns that China's gradual easing of its zero-COVID strategy will fuel an alarming surge in infections, which in turn may lead to the presence or emergence status of new variants that Professor Sohn mentioned earlier. Do you share these concerns?
Yes, I do, but my primary concern is for the high number of people who may develop severe disease and also die due to COVID in China. Unfortunately, the vaccine effectiveness of Chinese manufactured vaccines against Omicron are only about 60%. If they use a Chinese manufactured, for example, Sinovac booster, the vaccine effectiveness against severe disease due to Omicron increased to 65%. Using an mRNA booster that improved vaccine effectiveness against severe disease to about 90%. But the question is, how much of the population has received an mRNA booster on top of a primary series of Chinese vaccine? And so that's my first concern, is within China and in countries that have used a Chinese manufactured vaccine, we may see high levels of severe disease and death. The second concern is not just China, but in countries, for example, that use the Russian vaccine, Gamaleya, so Russia and other countries, we have a very big lack of information in terms of how effective this vaccine is. And so we may see high levels of disease, COVID disease, in Russia and other countries that use the Russian vaccine. I'm concerned about countries where they have high levels of co-circulation of respiratory viruses, such as Canada. They have high levels of COVID, RSV, influenza, and other respiratory diseases, and this increases the risk of recombinant vaccines. And then, as we've talked about, we're just not testing. We're not doing the kind of high levels of genetic surveillance as we did before. And so even if we do have a new subvariant or variant of COVID or a recombinant virus, we may not be able to detect it until much later after it has spread widely. And so I have a lot of concerns about what may happen, not in China, but around the world.
Right, and hopefully health authorities are listening to your concerns as well, Dr. Dan. All right, as always, Dr. Dan, thank you very much for your time and your thoughts. And Professor Sohn, thank you very much for your insights today.
Thanks for having me.
Thank you.
Right, well, that is all the time we have for today. Thank you for watching.